So red blood cell, it has a lifespan of 120 days. After these 120 days, or even if we have abnormally shaped red blood cell, it's being catabolized through reticuloendothelial system, or what we call a macrophage system. So the RBCs then broken down into tissue in tissue macrophage system, and the main product of destruction is the hemoglobin. And as we know, the hemoglobin structure composed of 4 subunits, and each subunit contains central heme group and polypeptide chain. So 2 alpha polypeptide chain, 2 beta polypeptide chain, and 4 identical heme groups. And then hemoglobin is catabolized to globin part, which hydrolyzed into amino acids, and these amino acids is being reused in formation of new hemoglobin. While the heme part, the heme group, is also catabolized. But let's see the first what heme group structure. The heme group structure is composed of central iron atom and surrounded porphyrin ring, which is an organic compound, the surrounded porphyrin ring. The central iron atom is then, after catabolism of the heme group, the iron atom, the central one, which is a ferrous state of the iron, is then used in synthesis of new red blood cells. So what's going to happen for the surrounded porphyrin ring? The porphyrin ring is then converted into biliverdin and consequently into bilirubin, which is the yellow pigment. This bilirubin, which is unconjugated in this state, then transported into liver. Inside the liver, the bilirubin is get conjugated. So we have unconjugated bilirubin conjugated to a structure called glucuronic acid, so through an enzyme called glucuronyl transferase, then we get the conjugated bilirubin. So now we have conjugated bilirubin inside the liver. But we notice that the bilirubin, which is unconjugated, is water insoluble, while the conjugated bilirubin is water soluble, so it can escape into the systemic circulation and appears in urine. Just some of these conjugated bilirubin. So what is going to happen for these conjugated bilirubin? Conjugated bilirubin then secreted into the bile and gives the bile its yellowish color. That's why the conjugated bilirubin called bile pigment. But what is bile? The bile that contain these conjugated bilirubin, what is it? And what the contents, other contents of this bile? The bile is a yellowish to greenish fluid secreted continuously by hepatocyte into the biliary system. And the bile contents, one of these contents, as we know already, is the bile pigment, which is conjugated bilirubin, and we know already how we get this conjugated bilirubin. So other contents of the bile that's being secreted by the hepatocyte in the liver, the other contents are water and electrolytes, all electrolytes, sodium, potassium, chloride, and even bicarbonate. Also, we have bile salts and bile acids, and both these structures are similar, bile salt and bile acids, because the bile salts are they are sodium salt and potassium salt of the bile acids. So through this video, when we say bile salt or bile acids, they are very similar, but there are some difference that I will explain later. So we have bile salts and bile acids. We have also bile pigments, which is the conjugated bilirubin, and also we have cholesterol and phospholipids, in addition to alkaline phosphatase. So we can consider this bile as a bus, and those are the passengers. And the most important, or VIPs passengers of this bus, are bile salts, bile acids, and our conjugated bilirubin. Let's see what is the function of this bile, which is being secreted by liver. The function of these, one of the most three functions of the biles are, first of all, is neutralization of acid chyme. As we know, the stomach content, the gastric content, when it reaches to the duodenum or intestine, it's of acidic concentration, so needs to be neutralized through this bile and other uh, contents also. The second function of this bile is fat digestion and absorption, and this is through the emulsification and micelles formation. And we are going to see what emulsification and micelles formation means. So, fat digestion and absorption. The third and one of the important function is it is an excretory route for bile pigment, our conjugated bilirubin. It's an excretory route for this bile pigment, bilirubin, cholesterol, and some drugs. So let's see what is going to happen to bile after it's being secreted by the liver. Bile, we 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 just considered bile is the bus with its contents. We want to see what is going to happen for this bile and what is going to happen for our VIPs passengers, bile salts and bile pigments. The bile being secreted from the liver to the biliary system into the small intestine. Inside the small intestine, when it reaches to the ileum, and especially in the terminal ileum, 95% of bile acids is absorbed into the liver, and only 5% passes to the colon or large intestine. Inside the colon, as we know, we have intestinal bacteria. These intestinal bacteria is converted the bile acid into the secondary bile acid. So from the primary bile acid into secondary bile acid. These bile acids, it has two routes. The first one is these bile acids is being secreted into the stool, and some is absorbed back into the liver to be reused in the bile and secreted again. So only 5% passes to the colon or large intestine, and even here, the after being processed by the bacteria, intestinal bacteria, the bile acids absorbed or secreted into the stool. So we notice that the bile acid absorbed into the liver, reused in the bile, and secreted again into the intestine. So this is about bile acids. What about the bile pigment? What is going to happen to the bile pigment, our conjugated bilirubin? So again, in bile passed into the biliary system, into the small intestine, and the conjugated bilirubin is not absorbed or being processed or catabolized in the small intestine, but it passed to the colon or large intestine. Inside the large intestine, the conjugated bilirubin by intestinal bacteria is converted to urobilinogen and stercobilin, both considered as urobilinogens. So it's not what is going to happen for the stercobilin. Stercobilin is secreted in the stool and gives the stool its characteristic color, while the urobilinogen is absorbed back into the liver. 10% is absorbed back into the liver, and only some, escape into the kidney to be excreted in the urine and gives the urine its uh, characteristic color. So now the bile, now as we said, there is bile acids and bile salts. The bile acids, when it's conjugated to glycine or taurine amino acids, it gives us the bile salts. And this is only to explain that they are very similar. Okay. Most of bile acids, 95%, absorbed um, in terminal ileum and return to the liver, then secreted again in bile. As we notice here, the bile acids, 95% absorbed into the liver, um, then secreted again in bile. This is known as enterohepatic circulation. Um, so daily loss of bile acids in stool is only 0.2 gram. Only 0.2 gram is being lost, and this 0.2 gram is resecreted or produced by the liver. So liver only needs to produce only 0.2 gram, which is a tiny, small amount of bile daily. And this is one of the benefits of enterohepatic circulation. So bile salts also recycling in this enterohepatic circulation. And the benefits or function of this enterohepatic circulation, it keeps us, increases the flow of bile, and also decrease synthesis of new bile acids. And that's why it's considered as a choleretic factor. And what we mean by choleretic factor? All factors that increases the volume of secretion of bile from the liver. So it's the choleretic factors, like other choleretics factors, like secretin and vagal stimulation, also considered as choleretic factors. Okay, moving on. As we know, one of the function of the bile is fat digestion and absorption through, as we said, through emulsification and micelles formation. But what is emulsification? Emulsification is the breakdown of a large fat droplet into smaller ones. And this is, after breaks down, it facilitates digestion by increasing the surface area of the fat droplet for action of lipase. While the micelles formation and formed by the bile salts, and it facilitates the transport of the lipid molecules to intestinal wall for absorption. And let's see, explain it more. So regarding the emulsification and micelles formation. So emulsifications also involve formation of the micelles, by the way. How emulsification happens? If you have oil drop, large oil drop through the bile, it's get broken down into smaller oil droplets. This is what emulsification, simply. While the micelles formation, we can define the micelles as cylindrical structure formed by bile salts and phospholipid in bile, arranged in a way the hydrophilic part, which loves water, parts project to the outside, while hydrophobic part to the center inside. And the lipid molecules enclosed in the center of these micelles. Let's see here. This is an oil droplet, and this is the bile salt. With one side is hydrophilic, which is loves water, and hydrophobic part, hydrophobic part. So it's arranged in a way the hydrophilic part is outside and hydrophobic part is inside toward the center, enclosing the central lipid part. This makes lipid soluble in water and facilitate transport to intestinal wall for absorption.